Hello, this is Dr. Ake here, and just a quick message regarding children and babies on airplanes during flight and why babies cry a lot more when they're on airplanes during flights. Now, some people would have done a bit of research on this, and others might not have done that. And some people get irritated when babies are crying a lot on flights. Um, Others don't. But I think it's also good to understand the background of this issue for children and babies, particularly up to the age of 8 years old, and more so up to the age of 5. It's mostly to do with the developmental side of things, the way the body changes and how the body adapts in that age group. Having going on flights, there are all sorts of situations and changes, because when you go on flights, you're going into very high altitudes and you're looking at significant changes in the atmospheric pressure or the barometric pressure. Very similar, or quite pretty much the same thing if you go underwater, deep sea diving, or any sort of travel, or diving or swimming below water when you're looking at very, very significant depths. As you go down, the pressure changes seriously, and that can affect your health, your body, in various ways, and in some ways pretty dangerous. So it's important to understand these things. Now, children and babies in general cry. There are many reasons why. The most frequent ones, obviously, would be if the child is hungry. So hunger's one. The child's thirsty, so thirst is another one. And then if the child is in pain or has got itching or discomfort, which could include being nauseous, really. And you talk about the nappies. So the child's got a soiled nappy that needs changing, or the child's got a wet nappy that needs changing. All of this can be irritating factors, and triggering the child to cry. And also the change of the environment, the setting that has changed. So the sights and sounds of a new environment, the different new faces or the new voices. So all of this do play a role. But essentially, when you are on the flight and the child, who's obviously particularly below the age of 5, their eardrums do take a lot of battering with the change of the atmospheric pressure. That can cause a lot of pain. Now, if you take a pack of crisps, or if you take a football, and which is not fully inflated, for instance, or even if it's a bit inflated, if you take it on board, you would notice how it expands and is on the brink of bursting. Now, that is a sort of pressure which the eardrums in children go through. There's an expansion and a significant tensile pressure, and it feels like it wants to burst or rip. So it's really painful, and we perhaps need to be a lot more sympathetic to these children on flights. And in a very similar way, they would have problems with headache. And if, for instance, you imagine the skull of children and babies are pretty much a lot softer, and in a nutshell, what happens is up to the age of 2, their sutures are not completely closed. Their fontanelles, the posterior and the anterior fontanelles, are there. Now, the posterior fontanelle will close a bit earlier, around the 7th to the 10th month. It usually closes a lot earlier within that first year of life. But then the anterior fontanelle, which is slightly to the front bit, closes a lot later, and it should close by the 2nd year. And if these suture lines close too early or don't close, or close a bit too late, there are consequences. And for instance, with craniosynostosis, where the sutures are closing too early, there's too much pressure in the head and the skull and within the brain box, which means the skull will have to change its shape to adapt the brain in terms of the growth. So this is all things you would notice. But I think the bottom line here is it is a lot more painful when your soft skull is being put under a lot of pressure from atmospheric pressure changes on flights. So yeah, these are some of the things to bear in mind. So perhaps it's a good idea if parents bear that in mind. 45 minutes before your flight takes off, the child gets some painkillers, some pain relieving medication, paracetamol, or ibuprofen, things that can help them, or actually both in some cases, to help control the soreness and the pain. Having said that, if the flight's a long one, you might find yourself having to repeat these medications 6 hours later, or 4 to 6 hours later. Of course, if the child is comfortable, you don't have to bother yourself with medications, but just bear in mind that you might need to do this to keep the child slightly more comfortable. If a child has a cold, it's even worse, because with the cold, there are all sorts of secretions and inflammations around the throat, and that will pressurize the eustachian tube between the throat and the ear. So the pressure gets worse. There's a sort of a vacuum sensation going on in there. That's not very nice. Now, this will also be the case for adults. If you've got a cold and you go on flight, your sinuses and your eustachian tubes, which is the passage between your throat and your ear, your inner ear, would take a bit of a battering with the change of atmospheric pressure. So you find yourself a bit sore and a lot more painful. So all this in mind, you might need to take remedies to keep you a little bit more comfortable. Obviously, things like deep vein thrombosis, which can happen due to longer flights. Again, it's all, you're looking at the changes, with the atmospheric pressure, more or less. It's more to do with this sort of changes, because soft things like your veins can take tension and pressure, which can change the way you get the normal flow. So these are the things to bear in mind, but particularly for children, it's more to do with the skull and the eardrums. These are where the problem is for them. So they might need a bit of pain relief, just before the flight to help them, and perhaps during flight as well. So just things to think of, and it might just make them more comfortable, because it's not an easy thing for them. Okay.